Well, hey guys, Chrissy Teigen has announced on social media that she had an eyebrow transplant. In today's video, I'm going to be reacting to this. She got a lot of criticism on social media for sharing this. People were saying, this is a rich person's problem, getting your eyebrows transplanted. She said something along the lines of, oh, I never wear makeup unless I absolutely have to, so this is gonna be a lot more convenient. And so people were like, oh, well, lucky you. But there can be a lot of reasons why you might want to have an eyebrow transplant. First of all, why the heck do we have eyebrows? What are they for? They function to help keep moisture and sweat out of our eyes. They play a vital role in facial expression and facial recognition, so much so that there was a study done where they showed people images of famous people either without their eyes or without their eyebrows. And people were better able to recognize the celebrities without their eyes than they were without their eyebrows. So it's really important for just facial recognition, and it can have an impact on your self-esteem if you lose your eyebrows. Now, she cited that she had plucked her eyebrows in her younger years, cautioned her audience against doing this, attributed her eyebrow thinning to over plucking. Now, that is something people commonly say, oh, I plucked my eyebrows and that's why they're thin. But what are the reasons why somebody might lose their eyebrows? Probably one of the most common reasons cited for loss of eyebrows is actually a burn injury. It can be a chemical burn, an electrical burn. People who smoke crack cocaine frequently will lose their eyebrows due to burn injury. You can also lose part of your eyebrows if you have to have surgery, corrective surgery in that area, say to remove a skin cancer. Now, one of the many joys of getting wiser, aka older, is that our eyebrows do thin as part of just the natural aging process. Then you could have loss of eyebrows secondary to an underlying condition. There's something called alopecia areata, which is an autoimmune hair loss, and it can affect the eyebrows. You can lose your eyebrows. Hypothyroidism or low thyroid hormone can lead to thinning of the eyebrows. People who have eczema can develop thinning of the lateral portion of the eyebrows. And people with that rough and bumpy skin condition, keratosis pilaris, in some cases it can involve the brows and you can have sparse brows as a result of that dry skin condition. Now, if you are an overzealous plucker and you pluck your eyebrows, it certainly can contribute to change of the eyebrow shape and thinning of the brows, change in the direction of the way the hairs grow because it traumatizes the hair follicle. And then of course there are rarer causes of thinning of the eyebrows, certain congenital diseases like ectodermal dysplasia, and you can also have certain infections that end up presenting with what's called matterosis, loss of eyebrows. And if you have to have radiation therapy as part of cancer treatment, then that can impact the eyebrows as well. Honestly, she didn't really share too much of her background motivation for doing this other than it seemed like she was under the impression that this was somehow going to simplify her life and that she wouldn't necessarily need to do her brows. It's kind of mind-blowing, right, that you could have an eyebrow transplant. You may be aware of the fact that people get hair transplants, but you can have hair transplanted to other body sites, including your eyebrows and your eyelashes. How exactly does this happen? Well, you need a really, really good plastic surgeon or dermatologist who specializes in hair transplant and has a long-standing track record of doing this because it is quite literally an art. What do they do? Well, there are a few ways that they can go about collecting the donor hairs. They can collect it from either your scalp or a body site. They can do it by taking kind of a strip of the hairs in an excision and then transplanting them to your brows, or probably what's a little bit more common is that they harvest each of the little individual hairs by kind of making a little circle around the hair and lifting it up and then transplanting it to your brows. In order to get it into your brows, they make little holes with a hypodermic needle and then very carefully place those donor follicles into the brow area. And this truly is an art. Not only do you have to harvest hair that's going to be a good match in terms of color, texture, but also you have to take into account the direction the hairs grow, the overall brow shape, ethnic differences in follicle density in the brow, and there are gender differences in terms of follicle density and the overall way in which the hairs grow. Now, if you've lost your brows due to trauma or a burn, it may have damaged and caused scar tissue, in which case the follicles are not going to take. And so you may need something called a composite graft. That is another approach to doing this. But in some cases, those end up failing because you don't have good enough blood supply as a result of the scarring. Another option is actually something called a flap, where you can take tissue from a neighboring area. In this case, it's going to be most likely the temple area, and you can literally position it into the brow area, and with that comes its own blood supply. So that is another option. Vital to the success of this procedure is going to be the post-operative care. You can't get the area wet for 5 days after the procedure. You're going to be given an antibiotic to prevent infection, and you're definitely going to need to follow up about 1 week after the procedure to make sure that everything is going along accordingly. And you're gonna have a little bit of redness around the follicles. That lasts maybe a few days. So you will see that, and that can be alarming to patients, but it's totally normal and it resolves. You have to be patient, unfortunately. Initially you get the procedure and you're like, wow, this is great. But then about 2 weeks after the procedure, the transplanted hairs fall out. That is normal. It is a telogen effluvium. It's kind of traumatic to be taken from where you've lived your entire life, say the back of the scalp, and be transplanted in a whole new area of the body. And so those hairs shed. That is expected, it's normal. But beginning around 4 to 5 months, you will start to get eyebrow growth. Now, when it comes to this procedure, one thing that is factored in is the donor hairs. Where are they coming from? Commonly, the occipital scalp, the back of the scalp, is an area that is used, but there are some issues with that type of hair. It doesn't necessarily match up to eyebrow hair, and it grows a lot faster than eyebrows. So you have to trim your eyebrows very frequently, which I think is interesting because she mentioned, or kind of alluded to the idea that she was sort of doing this because, oh, wouldn't it be great to not have to wear makeup as often? But she's maybe trading in having to be trimming her eyebrows. Alternatives include the leg hair. Actually is a little bit more slow growing and slightly more similar in terms of texture to brow hair, although it depends, it varies from person to person, gender differences, ethnic differences, and just hair texture. But that is another option that has good success. Also, hairs can be harvested from the sideburn area. I wouldn't say it is a rich person problem. If you have ever lost your eyebrows secondary to a medical condition, it can really have a negative impact on your self-esteem, and they have a function to keep stuff out of your eyes. They also help keep excessive light out of your eyes. So it's really, if you've ever lost your eyebrows, it's not something that is as easy as it sounds, like, oh, big deal, you don't have this little strip of hair there. No, it definitely has an impact, and is important for facial expression, conveying emotion, and for facial recognition. So if you have this, don't let those comments that she got make you feel bad about considering getting an eyebrow transplant. Now, if you've lost your eyebrows due to an underlying medical condition like hypothyroid, or say you have alopecia areata, or you have keratosis pilaris, those people who have brow loss secondary to an underlying condition, they're less likely to get success with this. Why? Well, they still have that underlying condition driving things. For example, in the case of alopecia areata, you're still at risk for autoimmune attack of the hair follicles, including your newly transplanted expensive hair follicles. So those folks, this might not always be the best course unless your disease process is well controlled. But I would say those are situations where it's less likely going to be a good option for you. Alternatives to having transplanted brows are tattooing or microblading, but there you're not actually getting the textural component of the hairs on there. So, that is an advantage here as well. She makes it seem as though she pretty much had this done for kind of cosmetic convenience reasons. And that's fine. There are tons of aesthetic procedures out there that are not medically necessary, but in some cases, this type of procedure, it really, is something that can be transformative for people who have lost their brows due to trauma, burn, and they do serve a function. How much does it cost? It's not cheap, close to $10K, depending on where you live. It's not the kind of thing that you want to shop around for the best deal on. You want somebody who is really, really skilled, because it is an art. Selecting the donor hairs, the donor follicles, transplanting them in the right orientation so they look right. Yeah, kudos to the plastic surgeons and hair transplant surgeons out there who do this. I think it is really cool. And again, it can transform somebody's life who has lost their brows due to trauma. It'll be interesting to see if she shares any kind of update. I mean, if you are going to put this out there on the internet, of course, there are going to be a lot of questions. So I wonder if we're going to get some sort of follow-up. It'll be interesting to see in 4 to 5 months if she's getting good brow growth, if she's going to have to be trimming her eyebrows. That'll be interesting to hear her comments on how she handles that. I wonder if she'll share that or if it'll just be forgotten, and who knows. But yeah, hopefully she does update us, just, you know, out of curiosity to the process, but of course she does not have to. All right, you guys, that's my response to her announcement of her eyebrow transplant. I hope this video was educational, informative, taught you something about eyebrows and eyebrow transplant. On the end slate, I'm going to put my last celebrity response video if you want to check that out, and I'll list some more in the description box if you are at all interested. But if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.